She was amazing. She cared so deeply for what she did, and she cared so deeply about the residents that she looked after. And ultimately, she paid the price for them.
Patricia Crowhurst worked as a carer for over 20 years. It was a job she loved, but her family is worried she put herself at risk.
I think there needs to be some form of investigation as to why so many people have died and why that it's being allowed, why so many healthcare workers and NHS staff and nurses, everybody.
Some COVID deaths could be investigated by the Health and Safety Executive, which enforces workplace safety. Sky News has learned the HSE has received 91 fatal disease reports relating to health and social care workers. 26 of these are in local authority care settings. For the HSE, these are huge numbers. Put in context, last year it investigated a total of 147 workplace deaths. Experts say the HSE must decide whether employers failed to protect their staff.
Was that risk reasonably foreseeable? Did we select the correct PPE? Did we have enough staff? Were they properly supervised? There are many things to consider.
What if the workplace says we just couldn't get our hands on the right PPE?
The health and safety staff is the responsibility of the employer, health, safety and welfare. And they've got to do everything that's reasonably practicable to safeguard their staff.
The HSE has the power to fine or prosecute NHS trusts or care providers in breach of the rules. I've spoken to one bereaved family who've been contacted by the HSE. They didn't want to talk on camera, but tell me they welcome the HSE's involvement because they've got serious misgivings about the level of protection offered by their relative's employer. They're not alone. Many families are now starting private legal proceedings.
Provision of PPE is one of the big issues and one of the big questions that we're being asked about. Were they provided with proper PPE? Was it fit for purpose? And if not, why was that the case? And if we're able to establish that the PPE simply wasn't there and should have been, that may be the first hurdle the families need to get over.
The Department of Health and Social Care says it's taken steps to remind employers of their responsibilities. In a statement, a spokesperson said the safety of our NHS and social care staff is paramount and employers should follow their legal duty to report the deaths of any staff who die as a result of exposure to coronavirus. We've been working around the clock to ensure PPE is delivered as quickly as possible to those on the front line. Patricia Crowhurst is one of the 250 health and social care workers Sky News understands have died with COVID. The HSE says it's committed to getting an accurate picture of those deaths and expects more will be reported in the coming weeks. Laura Bundock, Sky News.